Hello everyone, I am going to run through your CPT surgical assignment number 1. We're going to start with Gus. Let's just start with that he was 47. He came to the hospital for an insertion of the subclavian venous catheter, treatment of his prostate carcinoma. So with the operative report, let's check that out. The right upper chest was prepped, draped, local anesthetic. Then we have a percutaneous subclavian venous catheter. This was inserted and secured at the level. They did the sterile dressing, catheter was irrigated, and the patient was sent to recovery. So a couple of different things we want to look at here. I have an insertion of a non-tunneled, centrally inserted central venous catheter. Okay, our patient is 47, so we have to go with age 5 years or older. So we're going with the 36556. I did have a few students go with 36558. So if you coded that, that is for long term. This one is percutaneous, which means it is non-tunneled. It's through a short track, which is from the skin entry site directly to the point. So the correct code should be the 556. A few students coded 36600. Please review the difference in that one. They are inserting a catheter. They are not taking blood out for a diagnosis. And the other thing, if a student put in left or right, keep in mind, these modifiers, they provide supplemental information for procedures performed on paired structures, such as eyes, arms, breasts, knees, etc. Okay, so let's go ahead here. Let's go to number 2. Okay, for number 2, we have Maria, 45-year-old female, swelling of the neck, enlargement of the thyroid gland. Patient exhibits no clinical signs of hyperthyroidism. The physician does suspect lymphoma. They did a biopsy. They did a large hollow core needle. It's passed through the skin into the thyroid using ultrasound guidance. The tissue is sent for pathology, and the diagnosis is thyroid gland, and they are going to do chemotherapy. So with this, we have biopsy thyroid, percutaneous core needle. So let's just kind of look at that. Right here, we have core needle. We did the physician biopsy. A lot of students got confused on the ultrasound guidance. Okay, so if imaging guidance was done, then we're going to use that 7000 code. But they didn't use imaging. We are going with the ultrasound. So it should be a surgery code, not a radiology code. So a couple of students put, a 7000 code there. Any questions on that one, make sure you contact me. Number 3, Brianna. So we have adenoiditis, tonsillitis. Patient came into the OR. They did anesthesia. So let's look here. They went through the nose, through the oral pharynx, retraction, and then they did an adenoid. It was used to remove the adenoid tissue from the nasopharynx. Hemostasis was obtained. The left tonsil was grasped using electrocautery. It was dissected and transected at the base. Then they did the right tonsil. It was removed in similar fashion. Patient was awakened and then taken to recovery. So with this one, we are looking at 42820. They took out the tonsils and they did the adenoids. Patient is 6 years old, so under 12. So it's 42820. This code here includes both tonsils. If by chance they would have went in there and possibly just did one, you would have probably went with a 52 modifier for reduced surfaces, but you're never ever going to put bilateral for this. Any questions on that, let me know. Number 4, we have patient Miles Cloud, 60-year-old male, admitted for laparoscopic radical nephrectomy. The adrenalectomy, surrounding lymph nodes are also removed. Okay, so a couple things with that. So we are in the laparoscopic. Okay, so then we look at surgical. Remember, everything after the semicolon is dropped. We go down to here to the radical because that's what they did. They removed let me pull my book over here a little bit. And they removed the fatty tissue, lymph nodes, the adrenalectomy, just exactly what the report stated. So that one really wasn't an issue with students. So if you have any questions on that one, let me know. But overall, that was a good one. Okay, so the very last one here, Henry, sorry about that. He has a 2.0 centimeter lesion removed from the skin of the nose, including 0.2 centimeter margins. So it's done by Dr. Thomas in the office, sent to pathology. It is melanoma. Keep in mind, melanoma is going to be malignant. So a couple of different things that you have to remember. 2.0, okay, margins, you take it plus 2. So I go 0.2 plus 0.2 centimeters equals 0.4. Then I add that to the 2, so now I have 2.4 centimeters removed. So if I look at here, I have the other big thing too, make sure you're in the right place. So I have excision malignant lesion, and we know, including the margins, so let's go ahead and look here. They took it from the skin of the nose. Okay, so with that, I need to go down to the nose. So that's why it's going to be in this area. I had some students up in this area. I mean, that's where it kind of starts there, but we go down. We make sure when you're doing excision, you read through each category, and then this will help out. So just make sure you're in the right area. For a minute there, I kind of scanned to the wrong area as I read through it. I have to make sure that number 1, it's malignant. Number 2, I have to make sure I'm at the nose. So keep in mind, those are 2 big things. And then the third thing you're going to really want to look at is to get that right code is to make sure you add the 2 margins up and then add the lesion itself, which is 2.4. So the code here is 11643. Any question on this homework, please reach out.